What's up, guys? Yeah, I'm rocking the Iron Man t-shirt. But what I wanted to do was talk to you about a really crazy case study that just happened in my clinic this week. So actually, my coworker, physical therapist as well, injured his back over the weekend lifting weights. He was doing back squats, went down maybe a little bit too deep, a little bit uncomfortable with the positioning that he got into, had some butt wink, had some posterior pelvic tilt, and he felt a pop in his back and wasn't a good situation. He has a history of actually injuring his low back a couple of months ago, and he was working back into back squats. And he likes to squat deep, and he just wasn't necessarily ready to go that deep yet. Immediately, he felt big time cramping in his low back and shooting pain down his leg to his big toe. To put it the way he put it, he was absolutely debilitated. If he could have had surgery right then, he would have had surgery. He was at 10 out of 10 pain. So I wake up Monday morning to a text message from him saying, "Hey man, do you think you can come into the clinic a little bit early? I see my first patient at 7. He was like, "Can you come in at 6:30 and just, kind of take a look at what's going on?" Immediately when he walks in, he's got the biggest lateral shift I've ever seen. I mean, just completely hip shifted over, posture all off to the side, and he's in extreme pain. He's got a positive straight leg raise. He's got a positive slump test. He can't even really sit down because it lights him up. He is, like I said, visually positive for a lateral shift. He's got a positive crossed straight leg raise. So we just sat down, we talked about it. We're like, "Hey man, you know that this is a real situation where you've probably had a little bit of tissue damage, and we know what's probably going on here. You probably have an inflamed disc, and that's okay. We know that these things heal. We know that, with the course of a couple of weeks, a few months, you're going to get a lot better. What you don't need to do right now is freak out." So we tried a little bit of hands-on like prone PA springing just to see if that alleviated his symptoms. I did some really gentle manual nerve glides. I did a little bit of long axis traction, which felt really good while I had him traction, but felt really bad as soon as he got off the traction and stood up. So what we did was just very, very gently start working into hip translocations, just right up to the point where he was before the point of pain or he felt pressure, but then backed off. Got right up to the point of feeling pain, felt pressure, backed off. We called and canceled all of his patients on Monday, and I told him to go home, just stay standing as much as he could, ease himself into repeated lumbar extensions, and just walk. As many times as he could and he felt comfortable, just go out and walk, because he felt the best after he had walked for 10 or 15 minutes. We also gave him some supine, hook-lying, abduction, adduction isometrics just to pull as hard as he possibly could without any significant increase in pain and get a really good, strong muscle contraction. Almost immediately, he said he had a 25% reduction in pain with these strong held isometrics. So he started introducing a little bit of anterior posterior pelvic tilt in hook line, started doing these really strong isometrics, very gentle hip translocations and very gentle standing repeated extensions, and just walk as much as he could and do as many standing heel propped nerve glides as he could throughout the day. By the next day, Tuesday, he said he was already feeling about 30% better. His lateral shift had come down about 50%. By Wednesday, which was yesterday, he said he felt 80% better, almost completely normal stance, very minimal lateral shift, but he had numbness in his toe. So he just kept doing all the same exercises. He's back at work, he's standing all day, he's doing pretty good. He comes in today, says he has no pain at all, lateral shift is completely corrected, no tingling and numbness in his toe, no pain down his leg. And we got to discussing, did his pain get that much better that fast because we did anything special or super secret? Or was it because he understands the anatomy, he understands pain very well, he understands fear, he understands stress, and the fact that we were able to rationally talk through his symptoms, apply some graded exposure, some gentle neurodynamics, and really just keep him moving as much as possible without exacerbating his pain too much, was his nervous system able to calm down that fast? I mean, there's probably no doubt that he does have some real tissue damage there. There's probably no doubt that he does have a really nice disc herniation But even in the presence of this disc hernia, this possible theoretical disc herniation, because all of his clinical signs point to an acute disc herniation, how was he able to 4 days later go to pretty much zero pain and normal functionality? And how often do our patients who don't know what's going on in these situations absolutely freak out, get really fearful because of this intense pain that they're feeling? They don't know what's going on. They go in immediately, they get an MRI, it confirms a large disc bulge, and immediately they're on the operating table. Whereas if they would have known what was going on and they had somebody to rationally walk them through everything that they were experiencing and confirm to them that this does get better, this will get better, you can heal from this, it can be desensitized really quickly, how many surgeries would be avoided, how many lumbar injections would be avoided, how much narcotics especially, how much opioids would be avoided if we could get education to these people immediately within 24 hours of their injury occurring. And if we could get them to understand it like we do. So, tune in over the next couple of weeks. I'm going to keep you guys updated on his progress of getting back into lifting and all that sort of stuff. We talked about probably doing box squats to an elevated height and front squats and goblet squats and that sort of stuff instead of back squat all the way A to G, where he gets into a lot of lumbar flexion for a while. But hopefully you guys got something interesting from this, or it will cause you to think a little bit. And if you have any questions or comments or anything like that, please post them below. I think this is just a really cool case study where we were able to take somebody with good knowledge and a serious injury and see how the appropriate measures, the appropriate physical therapy management, the appropriate education and understanding of pain really caused a rapid resolution of extremely severe symptoms that theoretically could have gone very differently if he were your normal patient or your normal person in the population, and then had all of the fear and all of the stress, all of the cortisol, all of the adrenaline, all of that sort of stuff pouring into their bloodstream, just absolutely ruminating on this pain. How could that have taken his symptoms and his recovery down a different path? So if you guys have any questions, comment down below, share this around, share it with patients, share it with your friends, share it with your family. Disc injuries happen, but they absolutely heal. And in the absence of severe bowel and bladder problems or severe progressive neurological weakness, these things can and do get better if you don't freak out about it and you very gradually and strategically, progressively load into the positions that feel most comfortable and are alleviating and all that sort of stuff. If you do have one of these injuries, seek out a good rehab specialist, seek out a good rehab physical therapist or chiropractor or whoever it is that has a good understanding of this stuff and isn't a fearmongerer and can help you walk through this and let you know that it does heal. So share this around, guys. Have a good night.